Hi, I'm Marianne Aleardi, editor of SJ Magazine. Welcome to Health Moments. I'm here today with Dr. Vijay Verma, who is an interventional cardiologist at Lourdes Health. We're going to continue a discussion from the August issue about baby boomers and how to stay healthy. Dr. Verma, thank you for being with me today. First question is, for many baby boomers, they look in the mirror and everything looks good. They're not super overweight. They can exercise, they do things, and they take that to mean that their health is good. Is that true?
Well, not necessarily. I mean, heart disease and its onset can be silent at first, and you may not have any symptoms. Unfortunately, sometimes the first symptom is a massive heart attack or sudden cardiac death.
So if you're looking good, is there a way to know?
There are ways to look at your risk, and a lot of them are looking at your risk factors and making sure that they're well treated. Some risk factors you can control, some you cannot. Family history of early heart disease, age, men over 55, women who are in the perimenopausal time frame, they're at elevated risk. People with high blood pressure, high cholesterol, diabetes, and smokers are the people with the major risk factors. You know, overweight is also a minor risk factor, sedentary lifestyle. You know, so these are again all what we call minor risk factors. And by controlling them, and if you have a lot of these risk factors, you know, your risk of having heart disease is actually quite elevated.
What if you only have one or two?
You know, having one or two, you still have, you know, a substantial risk of heart disease. Again, like age, you cannot control, and as you get older, and if you have a history of diabetes, high blood pressure, high cholesterol, or if you've been a smoker, even in the past, your risk of heart disease goes up substantially.
What if someone has 3 or 4 of those risk factors that you just named? What should they do?
Well, the first thing to do is to see your physician, either in internal medicine, family medicine, or a cardiologist, and see what your true risk factors are. Have your cholesterol measured, have your blood pressure checked, go over your family history. Once they have these data, then perhaps you may need some sort of more non-invasive testing, such as a stress test.
So what is a stress test? What exactly happens, and what does it show the physician?
The stress tests are various modalities of stress testing. Common modalities that we see are when we put people on the treadmill and then we incorporate some other imaging with it. That is usually a better stress test than just putting somebody on a treadmill. And then we monitor their electrocardiogram, their EKG, while they're on the treadmill and look for changes, as well as we look to see on the imaging if there is any evidence of a blockage. If there is evidence of a blockage, then we would recommend that they have an invasive test, like a heart catheterization, to actually look at the artery and figure out if there's anything that needs to be done.
Okay. So if your stress test is normal, does that mean you're okay?
Not necessarily. The stress test, again, is looking for high-grade blockages, what we call 70% or more, that are actually flow limiting or blocking the amount of blood flow to the heart, especially with stress or activity. You can have small blockages that are less than 70%, and actually those more commonly cause heart attacks than the actual severe blockages, though. So the stress test is not necessary. It's a picture of what you're doing at that moment in time, and if your stress test is okay, then at that time you do not have a severe blockage.
Right.
That doesn't mean to say that because of your risk factors you may have some mild or moderate blockages that at some time could what we call cause plaque rupture, and that's the part of the cholesterol buildup ruptures and your body tries to clot it, and it by trying to clot it, it blocks off the entire artery.
Okay. So is there any way to detect if you have those minor blockages?
CAT scan, different CAT scan technologies, especially nowadays, they're getting better. They're not the gold standard test yet. It's still somewhat experimental. However, if you have these risk factors that I mentioned, you probably have some degree of plaque buildup anyway. So it doesn't really change how we end up treating the patient. You would still treat them with cholesterol-lowering agents, reducing their blood pressure, having them take an aspirin on a daily basis. We don't have the technology in 2008 to tell us which plaque is vulnerable to rupture, or which one is stable and is not going to rupture.
Okay. And I know you talk about technology. I know there is technology that you think is very useful in saving lives, which is the AED. Can you tell me about that?
The AED, it's an automated external defibrillator. It's basically a very fancy device that is very simple to use. Anybody can use it. Children can use it. You see them commonly now at airports or major sporting events. When someone has a heart attack, the reason they initially die is not really due to the heart attack itself. It's due to the abnormal heart rhythm that may occur because of the heart attack. When you block the artery off, the heart muscle starts dying, and abnormal heart rhythms may start occurring. And one of these heart rhythms, called ventricular fibrillation, may occur and cause sudden death. And about 350,000 people in the United States die suddenly of heart attacks. What's been shown is that if you have access to one of these devices quickly, within the first minute or two of having this, you have a very high chance of surviving.
And you don't need to be an EMT?
No. It's very simple to use. You open up the package and it has step-by-step, 5-step directions to show you how to put the pads on, how to push the button, and then the computer analyzes everything, and it tells you if a shock is advised or if a shock is not advised. You contact the EMS at that time and get them on their way, but it'll take them several minutes to arrive.
Sure.
Whereas if you have an AED, initially every minute that goes by after one of these episodes, your chance of survival drops by 10% each time.
That was fantastic information, Dr. Verma. Thank you for taking time to talk with us today.
Thank you for having me.
I'm Marianne Aleardi, editor of SJ Magazine. Thank you for stopping by.